So we've tried kind of the short timeouts. What do you say you do the most in terms of?
Probably I've gone in my room a lot.
Okay.
Just because of the fact that if he's not away from the rest of them, like he will try to like do something to his sister, you know?
Yeah, to kind of separate them.
Yeah,
to keep
because
them
I already know what's coming. I can tell by which cry and which scream at this point.
Yeah.
Like which one I gotta watch from. Now, and another thing you're not gonna need to do, I will not usually take him to a store or to a restaurant. That's if we're all together. Like if I was like me and the rest of the kids, I won't go by myself. Because he's taking off. Like he's taking off, he's screaming. Like like in a store, if I have them on, like we wait till the dad goes with it. So I have backup. You know what I mean?
Yeah.
I got young kids. Yeah. So that was another big thing with him is that he takes off. He knows like he's taking off. And I'm like,
Okay.
I mean, sometimes throwing him in the car and he'll climb out like it's.
You like that story?
Oh, we got a little one.
Yeah.
And that's his thing at the house too.
Yeah, it makes fun noises, huh, Johnny? Got it. So, and how often would you say he's running from you in public?
Okay, as soon as we go out.
Has he ever run into a street?
Oh yeah.
Yeah.
But he kind of got scared of me on that one because I was like, I freaked out on that because that was my biggest fear is always like the street thing.
Yeah.
We go to like He's Down a lot because we used to do that to try to, we thought it would kind of wear him out and we all had season passes, so we used to go a lot, but it's like even we'd be there from time it opens time it leaves and he would still be up for hours even after we get home.
And would you say he's kind of always on the go, kind of had trouble sitting quietly, playing quietly, staying in his seat? Yeah.
That's what the teachers told me too. Like the big thing is like she's trying to get him before he gets to kindergarten and stuff because you have to sit down.
Yeah.
But right now that is one thing. I guess they're trying to do one thing at a time with him, work on him. And right now, in school's been in session for a while, is staying in your seat.
Yeah.
You're supposed to. Don't talk, don't do this, and that's what they've been working on since the beginning.
Okay.
They said that so it's like you're supposed to learn this and that, but with them they're trying stuff like that. Like you gotta sit still, you gotta be quiet, that's what they're working on right now with him, I guess. So,
and have they changed like where he sits in the classroom or?
I guess they were working on that.
Okay.
I guess the way she talked the other day when she wanted me to talk to the behavior specialist, they've tried a couple different things. They thought maybe that he wants to sit on the floor, so they even made the thing on the floor for him.
Okay.
And then once they make the thing on the floor, he wants to sit up in the chair.
Got it.
It's kind of like one of those back and forth, I guess, things.
I see. Okay. Got it. Okay. You had mentioned some concerns about autism, particularly with dad and that strong family history. Have you ever noticed any kind of repetitive behaviors? So sometimes we see like hand clapping, spinning in circles.
His biggest thing that like I ever noticed is that we have a scooter. He'll ride this scooter for hours.
Okay.
Back and forth like this in our hallway. He's for a long time.
Okay. He's always kind of on that scooter. If you try and get him to transition off something like the scooter, for example, how will he do? So you're like, okay, done. We're done playing with that.
Well, especially now that the baby's crawling, like I've been trying to keep the scooter up because he's already ran over the baby's toes and I'm like raising his baby. So like I've been really trying to work on hiding the scooter. And it's coming and he was like, that's mine. And I'm like, yeah, it is. So we're gonna put it up. It's for outside now because the baby's starting to crawl and you're running over everybody's fingers.
Okay.
Yeah. Now it's starting to get easier for me. At first it was a big fight. And I think now he's learned, like, I'm not giving in because you're not hurting your sister. Like, you're just going to have to deal with it. So, like, it's taking a little less time on the screaming and the crying.
Yeah.
But now I'm to the point I just kind of throw it out the door and lock the door and go on with it.
Okay.
And then he's kind of like, well, I'm screwed now. Well, I'm going to throw it out the door.
So now he knows that's the limit. And
because at first I was moving it to another room, like trying not to have to go to that extreme. You know what I mean?
Yeah.
And then I was hoping, like, if I continue to do something long enough, if I continue to do something long enough that he'll eventually just be able to put it in the bedroom and without even messing with it.
Got it. And you had said that he kind of struggles with transitions in new places, changes to his schedule. What have you kind of noticed with that?
I don't know. I just noticed like he just don't do good with like So at school, they couldn't keep a teacher for a while. It was constantly a new teacher.
Okay.
And they would say he would cry a lot. He would not he just wouldn't go near them usually.
Okay.
So like they were having trouble for a while. They had to keep somebody that he knew, even the manager of the school thing that he had. She used to have to stay in there with him to help transitioning to somebody new.
Okay.
If that makes sense.
Yeah, that
I'm
makes
saying
sense.
stuff. I'm like, I hope it makes sense.
No,
Like,
that makes sense.
explaining
Yeah,
it.
I'll ask it further questions if I'm confused. Yeah. And if with the new teacher, would he seem really stressed? Would he have a tantrum? What would happen when?
Like if I was just taking him to school,
Yeah.
he would cry and wouldn't go in.
Okay.
He would run away from me. Like when I had the C-section this last time, the behavior specialist was there. She actually had to go run after him out in the playground because like he took off, and I was, here I am, C-section, running, catching. And he was used to her though because she kind of seen a little bit.
Okay.
And so she had to take him and be like, look, this is Hades and my friends. And it took it takes about a week or so for me to get used to them, and then start loosening up to them usually.
Got it. And when he runs like that, if you're holding his hand, or will he just run out of your hand?
Yeah,
or will
he'll throw himself down sometimes. Like he knows he's a big boy. He uses his weight
to his advantage? Yeah. How about, have you tried like door alarms? Have you ever run out of the house?
He knows better. His dad's really been like, that's one thing that will get you in trouble faster than anything is to open the door or run out my door.
Okay.
And he knows that probably because since he was 1 year old, like I've always pushed that, like with all my kids, like you don't open that door.
Okay.
And you don't go out that door.
Got it.
So like I've always pushed that even as a baby with him. So he kind of always knew that, if that makes sense.
Yeah. No, that makes
That's
sense.
one thing I was always scared of is you don't know who's going at your door.
Yeah.
And if you run out the door, you don't know who can grab you. Because like we live on a farm, but still, like I didn't want to teach him like you open the door for anybody, you do all that.
Yeah.
He pretty well does good on that.
Okay. Gotcha. And it sounds like he's pretty good at running, or at least compensating for his foot.
And that's the thing when school did evaluation on him for physical therapy, he's going to do it so well, and he don't even have to use it. When he's higher, his foot will kind of go like this.
It turns out.
Yeah, and
Okay.
he'll start falling.
Okay. And it's the right foot.
Yeah.
And okay. The more when he's tired. Did he have a brace for a while with that?
Tried a brace, but he wouldn't wear it. Like we had a hard time getting him to wear it. And then when we went to another physical therapist, she said that she didn't like the brace on him. It wasn't, that she thought it was making everything worse.
Okay.
And then on the left foot, they had another like ankle brace. Because they said his ankles collapsed in or something.
Okay. Yeah.
That's what the way I understood it.
Yeah.
So then they said something about maybe trying some type of tape, but then the insurance, something with the insurance, and then I never really got to see anybody else.
Got it. Okay. And when was that you last saw physical therapy?
That's probably right before he turned 3, so over a year ago. Okay. Which I've noticed sometimes, I think it's getting worse.
Okay.
His toes curl too, like this.
They like curl under?
Yeah, like when you put a shoe on, his feet curl under, and he can't go like this at all with the split. You can't. You gotta try to make it.
Okay.
And then on that big toe, you can tell like where it curls over. I don't know. It's weird. Like especially when he's tired, it gets worse.
Okay.
But he doesn't let it slow him down though.
And he's still able to run, climb.
He still runs, does all that.
Okay.
And just when he gets tired, you'll notice him start falling a little bit more and tripping.
Okay. How about with like fine motor skills? So feeding himself with utensils, is he able to do that? Okay.
I actually got a long, it's called, I think they call it like a sugar thing maybe.
Okay.
Where it's like a longer handle.
Okay.
I do like to give him that specialist cereal and stuff because for some odd reason he eats better with that longer spoon.
Okay.
But he can eat with all of them. I just give him that because for some reason it seems like he does better with it.
Got it. How about holding a pencil or a crayon, like being able to draw a circle?
I think he still holds it. I think he still holds it wrong.
Okay.
He like holds it, like he can. I think he can do it.
Does he kind of just grasp it or hold it from the top?
I think it's like the 3 fingers, like
Okay, so that's more of a grasp. Okay.
Yeah. He's left-handed.
He's left-handed. Okay.
Oh, yeah.
Can he dress and undress himself?
He wants to.
He wants to. Okay. Can he do like zippers? No.
Yeah, I used to always do the zipper.
How about buttons or snaps?
I don't know, never really put much on him.
Yeah,
To be honest
yeah.
with you, like,
No, that's okay. That makes sense. Okay. And he got physical therapy through First Steps. Is that correct?
so the lady, I guess, kind of did everything.
Okay.
And then she's brought in a physical therapist named Aideen, I think her name.
Okay.
Her name was Aideen. And she was seeing him. She was really struggling to get him to even do anything with her. So
Okay.
then she quit coming because, like, I guess you had to be able to do stuff with them or something. She said so. Like, First Step started to quit going. So then just that one lady was seeing him.
Okay.
But she definitely said like he needs something on the foot.
Okay.
But
Yeah, I kind of got lost.
I kind of got lost over the.
No, yeah, over the time in the pandemic. Yeah, I totally understand. How long was he in physical therapy for?
Since probably about a year.
A
They
year.
tried it for about a year.
Okay. Any other therapies that he's gotten previously? You said he was in early Head Start when he was 6 weeks. Is that right?
They started 6 weeks old, all the way until they're 30, and then they transitioned to Head Start. He gets speech at school.
Okay. Yes. Yeah. Yeah. It was good. We were able to get that so we could see that.
Yeah, I told the thing last time I was there, like, y'all can call and get whatever you want. Like,
Yeah.
I felt like it's easier for me to sign it.
Yeah.
You call and get what you want.
No, we got it perfectly. Yeah, we got it perfectly. Okay. And just going through really quickly, past medical history wise, I see that he has a history of acid reflux.
When he was a baby, they put him on AR because
Okay.
he would spit up a lot. He puked all the time as a baby,
Okay.
nonstop as a baby. Sometimes he'll still wake up in the middle of the night and be puking randomly, but it's gotten better the older he's getting.
Okay. Any other past medical history for him?
What?
Past medical history? Any other medical conditions?
He's had his tonsils and he's had tubes.
Yeah, he's had 2 sets of tubes, right? Poor guy. Having a lot of ear infections.
Yeah, and then it's like the older guy was kind of like, it just thanks for cleaning up.
Good. And has he ever had his hearing checked?
I'm sure school's done it.
Okay.
Usually school does all that.
Yeah.
Head start, and I thought they said that he failed one ear, but I think he I like had wax or something. I don't know. The doctor's office said he passed it, but the school said he failed it.
And do you remember if he passed his newborn hearing screen?
He did.
He did. Okay. Any medications that he's on currently?
No, I just give him the melatonin. I do notice. Do you notice he putting his hands to his hair?
Yeah.
That's something that started like the last 3 weeks.
Okay. And he'll just kind of run his hands through his hair.
He'll grab it.
Grab it.
That's a new thing the last couple of weeks that I've noticed. It's weird, like when you sit watching, like you notice like little things. It's like never was like that before.
Yeah. Okay. Interesting. Okay. And in terms of, you just said the melatonin, how many days a week would you say you give the melatonin typically?
I only really give it to him if I know he had a really rough day, and I know we're gonna have trouble trying to go to bed.
Okay.
I don't like to give it to him every day because I didn't want him to get used to it because they say melatonin, like some you probably get used to and you had to up it.
Oh yeah, well actually your body produces it naturally,
That's
so
what the
it should
doctor
be
said.
okay. Yeah.
But I always never really wanted to give it to him all the time.
Okay.
But then I tried to when he's really had a bad day. I noticed like he's had a bad day.
Mm-hmm.
Because I know like that's going to be a harder time getting to go to sleep.
Yeah.
So it just depends on his day. Like this week he had it last night because I was trying, like he was not going to sleep. I was like, oh my God, here you go.
Yeah.
And he still didn't go to sleep.
Okay. Okay.
But then he had it last week. He only had it once, I think.
Okay. Okay. I'm gonna let our Courtney take a family history.
So like I said, I'm from genetics. So when we're talking about genetics, we're referring to like our DNA, which is kind of the instruction manual for who we are. And the purpose of genetics is, I'm not necessarily thinking that there's any genetic conditions that we're thinking of at this point, but since you're here for a LEMS program and seeing all these specialties, we want to make sure that we're extra thorough.
Yeah.
Okay? And when we're talking about our DNA, you might know that we get about half from one parent and half from the other parent. So certain things can run in families that can act as clues so that we can better care for your child. Okay? So my job is to kind of just walk through your family history and ask you some questions about people's medical history, their learning challenges, if they have any. And I know that you've already mentioned some of these things, so I've tried to write some stuff down. I don't expect that you know everything about everybody, so it's fine if you just say, I don't know about them, okay? But starting off, I know that he has 2 full sisters, correct?
He actually has 7 brothers and sisters.
Yes, I do have that. 2 of the sisters are full, the same mom and dad, correct?
Yeah, I'm trying to think. Hold on. I got Evelyn, Lily, and Jonathan by the same guy, yes.
Yes, okay. So for those 2, are they healthy? Any problems so far with medical history?
Tell you what?
Any medical problems for them and that you're concerned about? Okay. Are they meeting all of their developmental milestones?
Lily still has speech problems, but
Is that the 2-year-old?
yeah, but I think it's because she has passing. I think that's her biggest problem.
Okay. And then you have a daughter, an 8-year-old daughter, correct? Okay. How is her health? Good. And she met all her developmental
She's in
milestones?
speech too.
Speech.
I was in speeches.
Okay. Health-wise, it's all good.
Yeah.
And then for his half siblings on dad's side, I have a 10-year-old, a 12-year-old, a 14-year-old, and a 16-year-old.
Yeah.
Okay. Anything that you can think of for them health-wise?
No, I think they're all really healthy.
All healthy. Okay. Any learning challenges?
I know the 10-year-old has behavior problems,
Okay.
and he actually got kicked out of like 2 or 3 different head starts.
Okay.
Other than that, the rest of them I think they're really good.
And when you say that that 10-year-old, he has some behavioral challenges, what exactly do you know what this look like?
Kind of like he was.
Similar. Okay.
The mom. So I know they split up when he was younger, and we actually got him for a couple of weeks because like the mom was like, I don't know what to do.
Right.
You know, he got kicked out of school, so we took him for a little while. I think a lot of it was just because he was the same way. Like he just did what he wanted. He don't like to be told no. He's still like that. Like it didn't change. But he's kind of the same way though. Like we yell at you, hit on you, and stuff like that.
And he's still that way like today.
Yeah. He's
Steal
very
it from me.
He's very like on the game, like you told me about the game. No, but he's also getting to that age too, like you know, that 10-year-old age. They don't listen as much.
And then like developmentally, do you happen to know if that child met their milestones?
Yeah,
has
they,
any ways?
I think him and the 12-year-old are actually like the ones that are in higher grades.
Okay. Academically and stuff, they're all.
Yeah.
And then I know that you said for yourself, you have a diagnosis of ADHD.
Yeah.
Okay. And you had speech when you were younger, speech therapy, and that helped for you. Okay. Any other medical complications?
I've had like, I was younger, I had my tonsils and stuff out, my tubes, same as film, but oh, well, I'm trying to listen, honey.
Would you like a snack, Mom? I can grab him something if you're okay with it.
You want a snack? Yeah.
Yeah, let me see what we have and I can grab you a snack.
Thank you. And then growing up, do you know if you had any extra help in school, any challenges besides the speech?
I did have extra help in school. Jonathan, I can't hear you. Please stop.
You want to come sit over here? No. She'll be right
I can't have hearing because I've had six sets of tubes in my ears. And this one's like, well, what? I'm like, stop, I can't hear. It's like I can't have hear at the time either.
All right. And then do you have brothers and sisters?
I have 3 brothers.
3 brothers.
I don't have anybody the same mom and dad.
Okay.
I have one brother by mom, one by dad, and the other one's adopted.
Okay. That's adopted into
Please
your
stop,
family.
please. I don't want it in my ear. I can't hear in that ear. Hey, do you want to go sit down? Stop.
he got in here? Do you want this one back? This was cool. We'll be done as soon as we can, but there's a brother that was adopted. He was adopted into your family.
So my dad used to be married to his mom. So they got him when he was like 7, I think.
And so then there's no, I just asked because when we're talking about genetics, it does matter,
So he
but
doesn't really
so,
matter.
no, yes. Still part of the family, he's on here.
Yeah.
But that's good to know. And then for your brother through your mom's side, any major medical concerns for him?
No, they said he was healthy.
Okay. Any challenges with learning for him?
No, he was pretty academic wise.
That's what you
Thank you.
nice.
Does that brother have children?
He has a little boy.
A little boy.
I don't really know much about that because my brother got hurt when he about 4 years ago. So now he's like in a nursing home. So I can't really tell you much, but
Any help in these?
You happen to know if that little boy is doing okay?
actually I think they were worried about him being autistic.
So maybe. How old is he about?
Aaliyah's 8. He'll be he's 8 then. Because they were only like 6 months apart.
Oh, wow, okay. And then for brother through dad's side, how is he doing?
Okay, that one. He's good. Now he had a lot of learning problems in school.
Okay. And can you tell me a little bit more about that?
I guess they said they're all a lot older. I'm the baby, so they're all like 40-some years old. So I'm trying to remember, but I've heard he was the one. Jason was the one that needed like one-on-one, I guess, because he couldn't understand it, couldn't read, nothing like that.
Good. Any health concerns for him?
Oh,
I mean, I don't think so growing up, but I can remember.
And does that brother have children?
Yeah, he has a daughter.
How's the daughter doing?
She's good. She's I think 5.
5?
Yeah, we all kind of had kids kind of close.
Yeah, you guys have a lot of cousins and siblings to play with.
Yeah, she has the kids, but that's the one that he actually had. So.
All right. And then for your parents, so for mom, does she have any major health concerns that you're worried about?
I don't know, like really what you want to know much, like my health concern wise.
It could be any.
Like I know she's like really bad diabetic. She's had cancer and all that. My grandma, like her mom, like all of them, they all had like bipolar, schizophrenia, and stuff like that ran in the family. I do know that much about her.
you know what this is?
And you said your mom had cancer.
Mhm.
Do you know which kind of
You know
She
cancer?
has thyroid cancer and
You point to
like
it?
some female cancer.
Okay.
No.
Maybe ovarian or
Yeah.
endometrial. Was she older when she had that, or was it kind of when she was younger in life?
It's been probably like 6-7 years. Aaliyah's 8. I think I just had Aaliyah, so probably about 7 years.
How was she in like her 50s, 60s?
57 now. I think she was probably
Around
around
50.
50.
Yeah.
All right. And for your father, any major health concerns for him?
He told me that in school he had a learning disability. He needed extra help. I guess my mom was always good in school. She said like she didn't have any learning disabilities.
Arm okay.
All right. Moving on to his father's side. What's his dad's name?
Rodney.
Rodney.
Okay.
How's Rodney doing? I wrote down that he also has ADHD, correct? And then you said possibly autism.
That's what he said when he got older. He's like never admitted to anybody. But his mom, I asked mom about it because he told me this, and she said as a kid they never did none of that. They don't believe in all of that.
Okay.
But he said when he got older, they said he's had some form of autism or something because he's very he's really good with numbers. You give him a number, he's on top of that.
Did any like professional help in that? Did he have any
said.
testing? Okay.
That's what he said. I don't know. Like
They're
that was
totally
before
fine.
me. And then He's pretty healthy, I think.
Okay, wonderful. And does he have siblings, brothers, sisters?
Yeah, there's 5 of them too.
5 full siblings,
Um,
same mom and dad.
Same mom and dad. He has 1 sister,
Okay.
and then he has a brother by the mom. And then he has, oh god, there's Tim. By the dad, there's Tim, Emmy, Tabitha, Natalie. So there's 5 by the dad.
Okay.
I'm like, hold on, I gotta try to
That's
count
okay.
all. I can't keep up.
All right. For the full sister,
Okay,
how is her health? Any concerns?
I don't think so.
Okay, any learning concerns? Okay. Does she have children?
Yes,
How many children does she have?
4.
4. And do you know anything significant about any of them?
I do know the younger one right now. They all don't believe in anything. They're the ones that's all parenting, nothing wrong with the kids. But she did tell me the other day the school called about her years. Jonathan's 4, so 6-year-old. That he's having it's not more or less, I guess, it's sitting down is to keep them focused or something.
Okay.
But other than that, I think they're all been good.
Okay. And then for brother through mom's side, he has the one brother
Yes,
through mom.
okay.
Okay.
He's been
Anything
good.
concerned? Okay. Any children for him?
He has 2 biological.
Biological. And how are they doing? Any
They're
concerns?
young. They're like 1, I think one's 1, one's 2, and I don't think they have anything with them.
And then I won't go through every
I was like, I don't really know all of them.
That's okay.
I can tell you a little bit about them, but
So through the siblings through dad's side, any major concerns that you can think of?
I don't think so. I
Okay.
think they all been pretty well good.
And their children, any concerns?
No.
All right. And then just his parents. So Jonathan's grandparents on his dad's side, how are they doing?
So his biological grandfather passed away in April, but he was the same way as Rodney. They said that they thought had some type of form of autism. Like really smart guy. The mom, they said, I think struggled in school or something. Like she needs a little bit more help. But they don't. That's just something they don't really. I don't know how much about.
And you said that his grandpa passed. No, kind of, was there a certain cause for that?
I think.
Do you want to pick your town?
I think it came about that, and then you know, kind of like a heart attack or something. I probably on it.
Thank you so much for going through all that. I know it's a ton. Can you think of any child who was born with any like birth differences, birth defects in the family? Yes. Okay.
Don't think so, except for like my cousin's kids. They're the ones with the autism and stuff.
So you're
I know on my mom's side of the family, a lot of like I don't know how to really put it, like MR and stuff like that ran really heavy through my mom's side. But they're like my later cousins. You know what I mean?
okay. So when you say your cousin, so your mom has a brother or sister. So you're saying that your cousins have a lot of like autism spectrum disorder.
Yeah.
So who exactly are your cousins? So I can add them on here. So your mom has siblings.
My mom said I couldn't even tell you all numbers.
Okay.
My mom's one of 18 kids, so I couldn't tell you.
Okay.
I just know that there's some in there that they talked about. And then my dad's dad, I pretty much know them better because I wasn't really allowed around my mom's side much.
Okay.
So I don't know them as well.
All right. So in taking all that in, I know that you have mentioned, you know, a lot of kind of learning challenges for individuals in the family. And I will also say that you have a pretty big family.
Oh, yeah.
But between both sides, there's just a lot of people in general.
Yeah.
And so I'm not super surprised that some people have challenges learning, right? Because it is just pretty common. So there's nothing that is screaming to me like a certain genetic syndrome right now. But I definitely think that, you know, it's good that we have this. And once you've seen all of the providers through LEND, we can certainly kind of take a new look at this and see if we think there's any way to move forward with genetics at all, if that's something that would be interesting for you. Okay. I will also say that a lot of things like learning challenges, like anxiety, bipolar, schizophrenia, psychiatric things, a lot of that is caused by little tiny changes throughout our DNA. That's not necessarily something we can test for, along with just our environment. So I will say that having those things in the family does put anybody at a higher risk than someone in a family without any of those things at all. But yeah, that's not necessarily something that I'm super concerned about. Any questions about any of that? I know it was a lot. Thank you. And thank you, Jonathan, for letting me talk so much.
I'm gonna finish my exam while you have him with you. Okay, so we're just gonna look in his eyes. And how does he do typically with ears?
He's usually good.
He's usually good. Okay. I know he's had quite a few ear things going on too, and then we'll take a look too.
You must have had stuff in your hands and put it straight through your hair, didn't you?
Oreo crumbs.
Yeah, he had the no lights, please. I know that.
She's just gonna look dry.
Yeah, there you go. Now I see that you're chewing well. I'll look at his ears once he's done with the cookie. I don't want to surprise him too much. He's hungry though.
Been up since, early.
Yeah, how long did you
We
guys
got-
have to drive to get here?
So originally it was like over an hour and 20 minutes, but then we stayed closer. We stayed then with his dad. So his dad lives like 45 minutes away. So
Okay.
kind of helped. Here, you're joking. Bubby, please get up. He's the messiest eater out of all my kids up there.
You're all done? All right, let me see these ears.
Let's look in your ears.
Let me look at his ear. Okay, buddy. You do great with that. Yeah, there's a tube in there.
There's still one in there.
There's still a tube in there. Did they put it in 2019? That was the last time I had seen.
I think so. Dr. Myers or somebody did it through children. So I think it was 19. I can't keep up with all of them.
Yeah.
I thought he lost one, but I thought
Yeah, I
the
don't
other
see
one,
a
I would
tube
thought
in
the other
it.
one came out by now.
That one is definitely still in though. Still, I mean, those tubes are really, really in there. I'm gonna take a look at his legs. It might be easiest if we get him over here.
We're over there.
I never worried about his legs and whatever. Did anyone
Wanna
ever
do
do any
some fun?
x-rays?
Let's lay down.
They did actually
like us on the
hip
Yeah.
So they're thinking about going. And then he's seen somebody and they say this drop foot.
Okay.
because they can't pick that foot up, I guess, off the ground or something.
And I'll just go there.
Okay.
Somebody
Are your
that,
feet
whoever you go
stinky?
to,
Mine might be.
or whoever does that. And it was somewhere in Louisville. I have to talk about the name, but she's seen it because the physical therapist said I would like to get him in a cast
Yeah.
or a brace to see, and she said it was drop foot.
I got you. Mom was just saying that he had x-rays of his hips when they were initially evaluating his gait. Yeah.
Yeah. And you said that he doesn't typically flex all the way back with his.
He won't, like, I've never seen him do it himself, like you can do it, but he won't.
He won't do it on
Yeah.
his
I think it was the right one, but I've been really trying to work with him on trying to get it like that, cause I work in a nursing home, so I pretty much know, like,
Yeah.
you keep wanna do it, but easy, Johnny, don't kick.
No, I know this is fun.
She's not gonna tickle your feet, she's just gonna move
I
it.
won't tickle, I promise. I
Here,
promise.
let her see your feet, sit here. Come on, we can go.
You're being silly now, huh?
Put your feet down so we can get done.
We're not.
Johnny, you don't kick.
That's okay, he's actually giving me good strength.
Okay.
This is the one on the right is the one. So the other one's straight and.
The right.
Okay, so I guess
there's Johnny, stop.
Johnny.
We're almost done, buddy.
It's his ankle, I guess his
Get out of this
ankles
room.
are like go in, they said when he, I never noticed, it's the woman that did the cat, or the, Lens is the one that told me, because I didn't know that.
Did you already listen to?
you need
to
stop, get up.
Any chance we'd actually be able, we'll get you kind of off camera for this.
Yeah,
like,
yeah.
Have you kind of take his hand.
Yeah.
so we can see it.
Let's just turn the video off.
Stop. Let's go, get up.
The video is off.
Get up. That's enough.
Good job.
I'm gonna listen to you real quick too, buddy, okay? And then we're gonna look at your legs. Are my hands full? Are my hands full? How about on the outside?
Any birthmarks or
On a
anything?
nice red sweater.
Johnny,
Let's see.
Yeah.
I know, my hands are cold, but I won't touch them.
That's
again.
enough.
How's this? Is this better? No? Not any better?
No.
y'all the first ones I should get to see my kids. Usually he's like,
Okay. Yeah, if you wouldn't mind,
Yeah.
he can keep his underwear on, but just slip his pants.
Johnny.
Socks off, please.
that's enough. Stop, come here. Stop, you're going to get
We're
hurt.
almost done, Johnny, I promise.
Get up, we gotta look.
You're going straight home and going to bed.
Did he not sleep well last night?
Oh, he just off and on. This is how he gets when he gets used to coming to the place.
Does he do naps typically?
At school he does.
At school he does.
You-
I might have to take him off all the way.
Yeah, I think we can watch him walk with. Yeah.
Take him off.
There you go.
Alright,
I don't know. They want to see
you
you
wanna walk to the door?
Walk to the
Walk
door
to
so
the
they
door.
see your feet.
Can you walk normal? Hi.
Johnny, walk. Walk right so we can go. You gotta listen.
I tell you what, can you follow me? Here, stand like this.
No, show me.
What's that?
Something hurt you?
Probably because you're running.
Oh, I think you bumped into
Did
the,
you stub your toe?
yeah.
No.
No? There's some on your butt. You need to look?
I think we actually see somebody else today too.
You do, and we'll walk you up to that appointment. It's a hearing appointment.
I was like, I'm on.
Yeah, you're doing well.
Yeah. Yeah, they long days for you.
Yeah.
It was so funny, the lady, I guess, the
I need
social
my
worker or something.
Yeah.
You want us to talk
She
about it?
thought she texted me all my appointments. Did they?
You walk over to mom?
She didn't because it's supposed to let Friday and then we get up Tuesday.
Johnny, come on now, this is enough. We still got another doctor's appointment to go to. Stand up and walk. Walk to the door, walk right. Because they want to see your legs. If you would just do what they want, we'd be able to leave.
We can all walk.
Okay, walk to the door so they
Walk
can
over
see you.
here.
There you go.
Good job.
Okay, all right. I'll walk slow back to mom.
Slow, slow. Like you were this morning when the baby was sleeping.
Baby
So
sister.
she tends to turn both feet out.
I do it
No,
this.
just the right one, I've noticed.
I do it that.
You do it like that?
Good job, buddy.
What's baby sister's name?
A baby.
Yeah.
Oh.
Go put your pants back on.
Yeah. So Lily on this is here, but he calls her baby. We'll not call her Lily, not her baby. The 8-month-old is Everly, and he'll call her Everly. Well, when you say baby, it's Lily.
But it's
not.
The 2-year-old is the baby.
That's the first baby.
Okay. Here we go.
I'm not really seeing much on exam besides the ear tube. And he does tend to turn, it looks like almost both of his feet are turned out, but I don't know if that's because he's walking silly or something
Yeah, I've
else.
never really noticed the left one. It was always the right one. And
Yeah.
I did, and everybody's even knows like it's getting worse compared to what it was.
Yeah. He's got really good flexibility though.
Yeah, like I can always do it.
Yeah.
And that was the thing when they gave him the, I guess the splint, they were talking about how he couldn't do it himself to keep working with him. So they were hoping he would eventually grow out of it, I guess. So my question was like, what do I do to get it fixed? You know what I mean?
Yeah. 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 I mean,
We'll also observe if you want to watch from behind when he's walking.
yeah, we'll watch him when he's walking out too. We saw him when he was walking in, so we got some good stuff for him. But time for you. I mean, really, that's kind of our goal today. We usually wait until the big kind of session where we share all the results of all the evaluations for kind of making a plan. Hear all of your concerns, get a full picture of what he looks like and who he is. Do you have any questions? Anything that you forgot to mention before?
I don't think so.
I know. So,
Thank you for your patience.
yeah, I know
I feel like
so
you
much.
said